I've seen different numbers in terms of percentages of what can be addressed through virtual care. What in your estimation with what you found, what's the percentage of people saying, for the average this and that, yeah, I can see virtual. This is the point though, however, where I need to go see someone in person.
Yeah, so I'm an emergency doctor. I'm also trained in family medicine, but there are some circumstances where you need me in the emergency department, and you should not be going onto a virtual care ecosystem. And those, thankfully, are not particularly common in the grand scheme of healthcare. And what I joke with people is, you go to an outpatient primary care office, and we're doing the same things in that office like Hippocrates was doing 2,000 years ago. We're pushing on your belly. We're listening to your chest with this thing, like the used to use one of those like cups that the kids use to listen on a door or whatever. Like that's. So we're doing all this stuff, but meanwhile we're in the 21st century, and we have blood tests, and we have CAT scans and MRIs and CTs and X-rays and all these other great investigations that we can do. And so from the perspective that I take and that we've seen in the literature, probably close to 50-60%, if not more, of healthcare in an outpatient setting can be done virtually. And when I say outpatient setting, that also includes, probably we know, 30 to 40% of emergency department visits are folks that have low acuity issues that could be in an outpatient setting. They don't have a primary care doctor, they can't get an outpatient setting, so they go to the ER. So all that huge proportion can be done virtually if the doctor is empowered to order those investigations, and maybe they're able to get a blood pressure, a heart rate, or do a video visit where they can have a look at you. Because so much of what we do in clinical medicine is, we look at you, and then we write appears well, appears unwell. We can tell how hard you're working to breathe, all this other stuff. So if we combine all these factors together, we actually get a really high proportion of folks that can be managed virtually effectively.